check your red light reflex here in your eye, okay? Let me try it again. Okay, there it is. Okay, you have it in red eyes, that's good. Now, I'm going to hold my finger out here, and I want you to follow my finger with your eyes, okay? Okay, on this side. Okay, now can you cover this eye for me? I'm going to put my finger out here, and you let me know when you can see it, okay? Now. Okay. Now. Okay. Okay, now I'm going to check your ears out here. I'm just going to palpate around your ears, make sure. Have you had any earaches or anything? Okay, that's good. I'm just going to, can you put your hand over this ear? And I'm going to whisper something in this one, okay?
Red roses.
Thank you. You're on the opposite side.
Blue roses.
Okay, awesome, thank you. Okay, I'm just going to use my little light here to look inside your ear. Okay. And I'm just going to pull up and back and brace this so you can't move against it. And looks like I can just see your membrane is gray and nice, but you do have a little bit of wax. Okay. Now I'm just going to look at your nose. Make sure everything's... Looks like it's smooth line. You've never broken your nose, have you? I didn't think so. Can you, if I put my, okay, and sniff on this side? It sounds like you're pretty open out there. I'm just going to use my hand here and grab your nose real quick. Okay. I'm just going to bend down here. I'm going to place your head here. Looks pretty clean. Just looks a little red. The other side here. That's pretty close. And also, sorry. Here. Okay, now I'm just going to kind of check your lips out here real quick. Oh, your lips look moist and nice. I'm just going to hold your bottom of your tongue lip down here and just check and make sure that's nice and moist and pink. Can you stick your tongue out for me? Okay, now I want you to touch the roof of your mouth with your tongue. Just checking to make sure I see the veins and your saliva down there. Okay, I'm going to just put this in your cheek and check the inside of your cheek. I'm going to get my light here and make sure I can see everything. And it looks nice and pink and moist. I don't really see any white spots. There could be any kind of thrush or anything. I'm just going to check your tonsils out here. Can you say ah? Okay, and everything looks good there. And I also heard you also jump when she said ah. Can I check your gag reflex now? Stick your tongue out. Okay, good gag reflex. That's good. And then can you just stick your tongue out, and I don't have a piece of gauze to grab it, so can you just kind of move it over that way so I can look and then everything. Okay, now the other way. Okay, everything looks good there. Now I'm going to check your neck out. Can you shrug your shoulders for me? Now, can you do it with me? Can you touch your ear to your shoulder in that one? How about your chin to your chest? Thank you. You've been patient. Okay. I'm just going to palpate your carotid here and take a listen to it. It's okay with you? Okay, nice show. I'm just going to listen here. Okay, that sounds good. Let's get on this side. Sounds good. Alright, I'm just going to kind of palpate your trachea here and make sure it's not deviated to either side, which it isn't. Okay, now I'm going to lymph nodes here. Okay, and it doesn't feel to me like you have any swollen lymph nodes or anything like that, so that's good. Okay. Now I'm just going to take a look at your upper extremities. Just kind of make sure you don't have any bumps or bruises on any of your arms here, which doesn't appear that you do. Have you got punched or anything lately?
No.
Anything of that nature? Okay. Can you do this with your shoulders for me? Okay. And how about, is this where I put your bicep down here, right? I want you to put your arm down. Okay, now flex for me. Okay, oh, you're strong. And now can you put your hand down like this for me? Okay. Alright, now I'm going to assess your brachial pulse here. It makes you feel yours because you're nice and skinny. It's wonderful. Your radial pulse. And I would, if it was irregular, I would do this for a full minute. Okay, now I'm gonna, can I just stand up? I'm gonna just take a look at your back here. Let's turn this way some in front of the camera here. No. I'm gonna palpate down your spine. Have you ever had any injuries to your back?
No.
That's good. Those are never good. Never turn out good. I'm gonna palpate out here. No pain or anything? Feel anything? Now I'm going to check your costovertebral angle. Just going to place my hand right here, and I'm going to just tap it, and if you have pain, that can indicate kidney inflammation. Any pain? Any pain there? Okay, that's good. Alright, now if I can just have you stay standing, I'm going to take a look at your back here. And assess your breath sounds. I also want to do this expansion here. Can you breathe for me? Okay, and she expanded, it was equal, so that's good. Alright, I'm just going to listen to your lungs now, okay? Deep breath. Another one. Okay, her lungs sound clear. That's good. If I can have you sit down now, I'm going to listen to your heart and all that good stuff. First, I'm just going to kind of count your respirations here, the rate, how deep they are in the rhythm, make sure you're breathing okay. Okay, just to save time, I'd say our respirations are about 20, but normally we would assess that for a full minute. Now, if she had her shirt off, of course, with a gown in the hospital, I'd be checking to make sure there were no lesions or anything on her chest. Now I'm going to listen to her apical pulse. She's heard best at the 5th intercostal space. Okay, and again, you would listen to that for a full minute to make sure it's regular or irregular. Hers did sound regular while I was listening to it there. And now I'm going to listen to her heart sounds. I think the right sound, right? All right. Okay. This is the aortic up here. And then we move down to the tricuspid. And like the apex is like the mitral. Then the 5th intercostal space, earth point. Then up here we have the pulmonic. And just listening to all these places just to make sure I don't hear any murmurs or anything irregular about your heartbeat, which I should listen longer, but it sounded good to me. Next we're going to do, do you examine your breasts at all? Oh, do you? That's wonderful. You should do it every month between the 4th and the 7th day of your cycle. You know that. In the shower is normally the best time to do it because everything's warm and nice.